Now, it's a year since the coronavirus first emerged and a grim milestone has been reached. Globally, it's estimated more than 2 million people have now died from COVID-19. That's according to figures compiled by Johns Hopkins University in the United States. One organisation which has been helping efforts around the world and in the UK is the Red Cross, with 5,000 volunteers expected to be involved in the coming ups. Eleanor Heavey is Head of Humanitarian Policy at the British Red Cross, and she joins us. Eleanor, thank you very much for talking to BBC News this Saturday. It is a grim milestone. How has your organisation been trying to maximise its impact in helping people to cope with this?
It is. I mean, it's a really colossal collective loss for the world today as we pass over 2 million deaths. And it's really important to remember that, you know, behind the figures are individual people and grieving families and impacted communities. And the Red Cross is at the forefront of the response to this virus across the world through our network of over 13.7 million volunteers. And as you say, here in the UK as well, trying to reach affected communities with food, with cash, with emotional support, and being involved in the vaccine rollout.
And particularly in the UK, that will mean presumably also helping to kind of, perhaps not the right word, but backfill, to help fill some of the gaps that inevitably created by the extra demands on health workers, actually, even in the hospital situations.
Well, the Red Cross has a long history of partnering with the NHS, and we're working in supporting over 100 hospitals at the moment. So everything from helping to free up beds and help people get home from hospital to providing emotional support and care, providing mobility aids, and also, as you say, supporting directly with the vaccine rollout itself.
How do you support the volunteers? It might sound a partly peculiar question, but they are kind of dealing with people who are emotionally fragile, if not physically fragile at this stage.
Absolutely. And all of us, you know, including our staff and volunteers, I think there are very few of us in the country who haven't been directly or indirectly impacted by this virus. So the psychosocial support and the emotional support to our volunteers and staff is absolutely critical, as it is to all frontline key workers and also to all of the affected communities that we support as well.
And what about for the Red Cross? I mean, so many of these organisations depend on voluntary contributions, they depend on charitable help, they depend on individual legacies and so on. Is this an issue for the charity sector and for your organisation? Not so much now, but worrying about the coming months and years ahead?
Well, there's an unprecedented level of support needed to meet the humanitarian need, both here in the UK and across the world. So we're encouraging people to donate to the British Red Cross Global Coronavirus Appeal and to get involved as volunteers. And we've seen overwhelming support from the British public in support of this crisis at home and around the world.
Eleanor Heavey from the Red Cross, thank you so much for being with us.
Thank you.